طيب اليوم هنتكلم عن الفيتامينز. إيش هم الفيتامينز؟ هم عبارة عن organic compound. بنحتاج إننا إحنا نوفرهم بكميات معينة في الدايت. هذه الفيتامينز they cannot be synthesized in adequate quantity by human، فبالتالي إحنا نحتاج إن نعمل لها supplementation. في عندنا نوعين من الفيتامينز، في water soluble vitamins و fat vitamins fat soluble vitamins. عادة الwater soluble vitamins بيشتغلوا as a coenzyme وبيكونوا important في synthesis of some coenzyme. بالنسبة للfat soluble vitamins only vitamin K هو اللي have a coenzyme function. They get released, absorbed, transported with the fat of the diet. They do not get excreted in the urine because they are not water soluble. Or they get stored in the liver and adipose tissue. الاثنين اللي ممكن يعملوا له toxicity من الكونسومشن هم فيتامين A وفيتامين D. هنا مهم انكم تعرفوا فيتامين K هو اللي يكون ليه coenzyme function من الفات soluble، والاثنين اللي بيعملوا له toxicity هم فيتامين A وفيتامين D. طيب ايش هم الفات soluble vitamins؟ هم KADE، تقدروا تحفظوها as كادي زي موية الكادي. So KADE هدول هم الفات soluble vitamins. عادة بيكونوا either from animal source or plant source, mainly from animal source من الليفر اللي egg yolk والfish والliver oil. هنتكلم عنهم واحد واحد وعن وظائفهم وعن effect of deficiency، وهذا كله مهم انكم تعرفوه. فالفيتامين A we call it anti-night blindness vitamin. هو عبارة عن لما نقول فيتامين A فهو عندنا either فيتامين A اللي هو الانيمال سورس اونلي أو البرو فيتامين A اللي يكون الكاروتينويد، وهذا الكاروتينويد عادة بيكون من البلانت سورسز زي الكاروت مثلا. طب إيش الميكانيزم اوف أكشن؟ أنا عندي الفيتامين A اللي هو ريتوريك أسيد. It will bind the high affinity a specific receptor protein، وهذه حتكون في النيوكليوس of the target tissue. إيش الفانكشن of فيتامين A؟ عندنا المين فانكشن هو الفيجوال سايكل، بعد كده عندنا الجروث، الريبرودكشن والمينتيننس of the epithelial cell. طيب إيش الإفكت of deficiency؟ إنه أنا حيكون عندي زي ما قلنا هو anti night blindness، فحيكون عندي night blindness المين characteristic والmanifestation of vitamin A deficiency. عندنا الزيروثالميا اللي هي dry eye والكيراتوماليشيا اللي هي dry cornea of the eye. كمان عندنا البيتوت سبوت هي كده تكون زي اليالوش سبوت في الاي في السكليرا، وكمان حيكون عندي respiratory or urinary tract infection و delayed the growth of the bone and teeth. طيب الفيتامين دي هو الانتي راكتيك فيتامين. we call it الكوليكالسيفيرول. أنا الفيتامين دي لما بأخده ما بيكون أكتف، فهو أنا لازم أعمل له أكتيفيشن. فكيف بيصير عندي أكتيفيشن للفيتامين دي وكيف بنحصل عليه؟ الكالسيفيرول الكوليكالسيفيرول حيصير له أكتيفيشن first in the liver بحيث إنه حيصير converted to the 25 hydroxy cholecalciferol اللي هو 25 OHD3 عن طريق ال 25 hydroxylase enzyme. بعد كده حيصير السكند اكتيفيشن في الكدني عن طريق الانزيم 1 alpha hydroxylase عشان ال 25 hydroxy cholecalciferol يتحول ل 125 dihydroxy cholecalciferol اللي هو 125 OH2D3. هنا لازم تعرفوا إنه the only active form هو ال 125 dihydrocholecalciferol اللي we call it calcitirol. طيب مهم تعرفوا الإنزيمات اللي بتعمل activation وكل إنزيم belong to which organ وإيش البرودكت اللي will result from this activation. الفيتامين D mainly we get it from the skin, from the sunlight. So it's mainly from the sunlight. A part of it we can get from the diet like الفيش and meat والsupplement. زي ما قلت لكم حناخده على كوليكالسيفيرول، بعد كده حيتحول من الليفر to 25 hydroxy calciferol and then the 125, the active form calcitriol. But what is the mode of action? It will bind a specific receptor in the cytoplasm called the vitamin D receptor عشان يعملوا لي الكالسيترول receptor complex. This complex will enter the nucleus and bind the specific site in DNA to stimulate the transcription of a specific gene into messenger RNA. Right, where we can find this receptor? We can find it in the intestine, kidney, liver, immune cells, beta cell of the Langerhans, testis, ovary, uterus, osteoclast and osteoblast cell of the bone, and parathyroid gland. So what is the function of vitamin D? The classical function is to maintain the adequate plasma level of the calcium. What is the mechanism of maintaining the calcium level? First, increasing the uptake of calcium by the intestine. Second, minimizing the loss of calcium by the kidney and stimulating a resorption of the bone when necessary. Then the non-classical function, it works as an anti-cancer, anti-inflammatory, anti-hypertensive, hypoglycemic effect, and improve the insulin resistance. طيب بالنسبة للdeficiency of vitamin D, in children they will have rickets, and that manifests by delayed teething, standing, and walking. The skull will be boxy in shape, and there is a delayed enclosure of the fontanelle. بالنسبة للchest, it will become like begon chest or rosary beads. The pelvis will be contracted, the leg will be knocked knee and bow leg. For adult, they will have osteomalacia. It can occur in the woman with repeated pregnancy and lactation because they will consume a lot of calcium and vitamin D. And then also in this cases, the bone will become soft and it will be easily fractured. We have a situation that called the renal rickets or renal osteodystrophy. فأنا دحين عشان نعمل activation of vitamin D, as I said, the first activation step will be in the liver, then the second activation step, it will be in the kidney. And that kidney step is the important one because the calcitriol produced from this activation is the active form. So when the kidney is diseased, there will be a deficiency of the 1-alpha hydroxylase enzyme. So the 125 dihydroxy cholecalciferol will not form, and then we're going to have hypocalcemia, increase the secretion of parathyroid hormone, increase the demineralization of bone, and it will give me a clinical manifestation that close to the ricket. This case we cannot treat it with administration of vitamin D3 اللي هو cholecalciferol. We have to give them the calcitriol, which is the active form, because if I give them the vitamin D, the cholecalciferol, it will not be activated and transformed to the calcitriol, the active form. So what we get from the vitamin D deficiency and diseases, as I said, vitamin D is an anti-cancer. It have a role in the nuclear transcription, and it regulates cell growth. تمام. As I said, it will regulate the cell growth, differentiation. It will make an apoptosis, and it will do a lot, and the mechanism of central to development of cancer. Also, in the cardiovascular disease, vitamin D can prevent coronary disease. It also activates the immune system, so it's important in infectious diseases. In the autoimmune disease, it protects against multiple sclerosis, systemic lupus, and rheumatoid arthritis. Also, it improves the insulin sensitivity and insulin secretion and reduce the diabetic complication. Now we will move to talk about the vitamin E, and we call it the anti-sterility vitamin. Vitamin E works as an antioxidant, and it also plays an important role in the immune system and in immunity against viruses and bacteria. The vitamin E deficiency causes hemolysis and hemolytic anemia due to accumulation of the hydrogen peroxide. It can cause also degeneration in the skeletal muscles, and that will lead to muscle dystrophy and paralysis with keratinuria. It also can cause a stomach cancer due to increase of the peroxide formation that will affect the wall of the stomach, and also can cause a hepatic necrosis. Then we will move to vitamin K. Vitamin K, it's the anti-hemorrhagic vitamin. Vitamin K produce a coenzyme Q, which is important in the respiratory chain. It also plays an important role in clotting. So it's a biologically activated clotting factor, prothrombin factor, factor 2, factor 7, factor 9, and 10. It's also essential for activation of bone protein, the osteocalcin, that help the calcium and phosphate incorporate in the bone. It will suppress the liver cancer cells and improve the lipid profile by increasing the HDL. The vitamin K gets extensively synthesized by the vitamin in the bacteria and in the gut. So it's usually uncommon to have a vitamin K deficiency because they can be produced by the intestinal bacteria. So what happens if we have a vitamin K deficiency? Vitamin K deficiency will lead to bleeding due to impairment of the blood clotting factor. And as we said, like it does not occur commonly, so it can occur in this following condition. Like in newborn, because their intestine is sterile and they do not have the intestinal bacteria. With the long use of antibiotic because it's killed the bacteria, liver disease like obstructive jaundice, and intake of anticoagulant. And an anticoagulant, it will do the opposite function. So that was about the fat-soluble vitamin. Now we will talk about the water-soluble vitamin, which is vitamin C and the vitamin B complexes. Vitamin C, we can get it from the fresh fruit and vegetables, as you know. Vitamin C acts as an antioxidant, important for iron absorption, and it has a very important role in collagen fiber, which is essential for tissue repair, wound healing, and bone formulation. The condition that associated with vitamin C deficiency, we call it scurvy. Scurvy is manifested by swelling, spongy, and easily bleeding gum, defective formation of bone and teeth, delayed wound healing, and easy bone fracture, fragility of the blood capillary, decreased resistance to infection. Then we have vitamin B1, which is the thiamine. Thiamine is very important for carbohydrate metabolism. It's also essential for functioning of the heart, muscles, and nervous system. The deficiency of vitamin B1 results in biochemical changes like accumulation of pyruvic acid and lactic acid in the blood, with neurological manifestation, peripheral neuritis, confusion, and muscles weakness. Also can cause gastrointestinal manifestation like anorexia, nausea, and vomiting. And the severe deficiency will cause a clinical situation called peri-peri. We have two types, wet peri-peri and dry peri-peri. The wet peri-peri cause a congestive heart failure, edema, and peripheral neuritis, while the dry peri-peri cause an atrophy of the peripheral nerve, numbness, and loss of sensation and paralysis. So when we talk about the vitamin B2, which is the riboflavin, it's important for body growth and red blood cells production. It's important in the structure of the FMN and VAT for energy, and they also act as a coenzyme for the hydrogen carrier in oxidation reduction reaction. The deficiency of P2 will cause glossitis, angular stomatitis, scoliosis, seborrheic dermatitis, and vascularization of the cornea. Then we will talk about the niacin. Niacin, it will be synthesized inside the human body from the tryptophan. It's need of the P6 enzyme as a coenzyme. And we need to have tryptophan in our diet so we can get the niacin. So it's important to eat a lot of meat to get niacin. It helps digestive system, skin, nerve to function. It's also a part of the structure of the NAD and NADP. It works as a hydrogen carrier in oxidation reduction reaction. Used in the treatment of the hyperlipidemia, which inhibits lipolysis and decrease the circulatory level of the free fatty acid and induce the production of the VLDL and enhance the production of the HDL. The niacin deficiency will cause pellagra, which is manifested by the 3D, diarrhea, dermatitis, and dementia. Then we talk about the vitamin B6. The vitamin B6 is a term of the three vitamins, pyridoxine, pyridoxine, and pyridoxyamine. They occur, pyridoxine occur primarily in the planet, the pyridoxyl or pyridoxamine usually from animals. The three combined serve as a precursor for the biologically active coenzyme, which is the pyridoxyl phosphate. What is the function of the pyridoxyl phosphate? First, amino acid metabolism. It causes the biosynthesis of neurotransmitter, serotonin, dopamine, and adrenaline or noradrenaline, and also the GABA. It's also involved in the synthesis of the histamine, and it's required for the conversion of the tryptophan to niacin, as I mentioned before. So what is the function? It also, first things was the amino acid metabolism, then it's going to be the glucose metabolism, as it's important in glycogen lysis and gluconeogenesis. Also for the lipid metabolism in the biosynthesis of the sphingolipid and hemoglobin synthesis and function. The deficiency of the pyridoxal can be caused by drug isoniazid and oral contraceptive, also by alcohol. And what that deficiency cause? It can cause confusion, depression, irritability, mouth and tongue sores. Then we will talk about the vitamin B12, which is the cyanocobalamin, which is the anti-percussionist anemia. It gets only from animals. So the vegetarian will have vitamin B12 deficiency and they need a supplement of vitamin B12. We can get it from the meat, liver, kidney, milk, and eggs. Absorption and transport, it's very important to know that it's need an intrinsic factor. It's need to combine intrinsic factor that produced by the gastric partial cell to form the B12 intrinsic factor complex. Then it will be absorbed in the distal third of the ileum and طريق receptor bind to this B12 intrinsic factor complex. The transported in the plasma by binding to plasma protein, the transcopolamine, and that's stored in the liver cells. The B12 gives cobamide coenzyme, and this is important, like as a methylcobalamin in the synthesis of methionine from the homocysteine. And the methionine will work as a lipotrick factor to prevent the accumulation of fat in the liver. Methionine also enter in the formation of the phospholipid that will enter in the structure of the myelin sheath. Also, the other one is going to be the deoxyadenylcobalamin, and that's important for the conversion of the methylmelanin-CoA to succinyl-CoA. And the methylmalonyl-CoA come from the catabolism of the odd number fatty acid of some amino acids. The deficiency of vitamin B12 will cause an increase in methylmelanoaciduria because it will not convert to the succinyl-CoA. So the deficiency can be caused by decreased intake in vegetable as the vegetarian, malabsorption syndrome, absence of the secretion of intrinsic factor, like in cases of atrophy of gastric mucosa, in old age, gastrectomy, and antibodies against intrinsic factor. The manifestation of the deficiency, first and most important, the precocious anemia, that can have a hyperchromic macrocytic anemia, a neurological manifestation like degeneration of the spinal cord, peripheral neuritis. Also, they will have atrophy of gastric mucosa. Second, they can have a failure of homocysteine and methyl malonic metabolism that lead to homocystinuria and methyl maloniaciduria. We will talk about the folic acid, which is essential for the maturation of the red blood cells and synthesis of DNA and RNA. The deficiency will cause macrocytic megaloblastic anemia without neurological symptoms. So that's the difference between the macrocytic anemia, hyperchromic anemia from the vitamin B12 deficiency versus the folic acid deficiency. B12 deficiency will combine with the neurological symptom, while people with folic acid deficiency will not suffer from neurological symptom. It also causes a neural tube defect, and that's very important to know that in the when women would like to plan for pregnancy, they need to get supplementation with folic acid to prevent neural tube defect. Then last things we'll talk about minerals. So the minerals are actually inorganic substances. They present in food combined form as salt, like sodium chloride. They also might be combined with organic compound like iron, hemoglobin, sulfur, and protein. They do not use for energy production. We can find them in all body tissue, soft tissue, skeleton, and fluid. There are two groups of minerals, macro minerals and micro minerals. We can also call it a trace element. Here it can just show you which one of the minerals called macro, which is the one that we know, calcium, phosphate, potassium, sulfur, sodium, and magnesium. And then the micro will be iron, with the trace element will be manganese, copper, iodine, zinc, fluorine, selenium, cobalt, and chromium. Last things we will talk about today, it's the zinc, which one of the trace elements. And it's really important because it's involved in the activity of more than 100 enzymes. It works as a transcription factor. The deficiency of zinc can cause delayed wound healing, hypogonadism, decreased adult hair, and predispose to alcoholic cirrhosis. And that's it. Thank you so much. Any question?
دكتورة، نحفظ الماكرو والمايكرو من المعادن ولا لا؟
ايوه، لازم تكونوا عارفين ايش ماكرو وايش مايكرو.
يعني ممكن نسأل عليها صح؟
اي نعم.